Well, good morning once again, and of course, thank you so much for staying with us on UBC, and of course, in particular, good morning Uganda. Now, we did be able to cover a couple of our segments earlier where we did have discussions into matters of national importance. And in addition to that, we want to still look at one very, very important discussion, and that is health, and majorly looking at vaccination. Now, we'll take a sneak peek into COVID vaccination, but all your touch we also will touch briefly about the polio vaccination. But with me to do that is Miss Immaculate from Ministry of Health, in particular the vaccination and immunization department. You're welcome, madam.
Thank you, Felix. Good morning, Uganda. Thank you for having us to speak to the nation this morning.
Good. How are the people at the ministry?
The people at the ministry are doing their best to plan and ensure the lives of Ugandans are kept safe so that we have a productive and healthy nation.
We are told we cannot access your premises if we don't have a certificate or vaccination card. Is that true?
Yes, it is true. It is one of the measures put in place by our leadership to ensure that the employees of the Ministry of Health and also to lead by example and show that in this area where we have an intervention, a cost-effective intervention to prevent the COVID-19 disease, there is need to support the employees in terms of enforcement and putting in place measures to ensure that we make it a requirement, first as Ministry of Health, demonstrate to the public, and also to protect our own.
Wow. Just now picking it up from there, I want us to talk about vaccination in terms of COVID-19. If you could just give a general overview, the picture of vaccination. The president came out to give us a target, a list of about 4.8 million people, so we can be able to have a reopening of our economy entirely. And how are we doing on that?
Yeah, we began the COVID-19 vaccination on 10th March this year. And for the last over 8 months, we've been targeting the high-risk groups. Okay. The health workers, teachers, persons above 18 with underlying illnesses, and we've reached, that's about 46% of that group has been reached. But in terms of the overall target of 21 million, we've reached 10% of the populations. So basically it was due to the resources, limited availability of vaccines, but as we see now, and with the more vaccines expected in the pipeline, we think we shall hit the target as guided by the head of state by end of December. Yeah, so vaccination has been ongoing in the district, and then the current, what is new is that we are trying to focus in particular high-risk districts, hotspots, where that have been Lango region, districts in the Lango region, and districts in the Teso region for now. And of course, we've continued with the second dose and first dose in the overall in the entire country. So all the districts have vaccines, but there's a bit of accelerated action in the Lango and the Teso regions.
Okay. Now, also speaking about vaccination, we've been hearing lots of mixed sense about these whole vaccinations. First and foremost, how many vaccinations do you have on, I wouldn't say the market or out there for you, for the public? Because when I say for market, it sounds like it's for sale or what. How many vaccinations or types of vaccinations do we have out there?
So since the launch, we've basically worked with the National Immunization Technical Advisory Group to approve vaccines to use in Uganda, and basically we focused on vaccines that are approved for use under the emergency use listing by the World Health Organization and also by the National Drug Authority. So we deployed the AstraZeneca vaccine. That was the first vaccine to be introduced. Then the Sinovac, then the Moderna, the Pfizer. That's what we've had. And then the Johnson & Johnson will soon be also sent the district, so it is still at the national medical stores. Yeah, so it is AstraZeneca, it is Pfizer, Moderna, Sinovac, and the Johnson & Johnson vaccine. So that's 5 types of vaccines against the COVID-19 pandemic.
There's a big challenge, and this is where we want your expertise in breaking, probably just giving light on each one. I have had people, even just yesterday, someone was asking me, I want this, me, I don't want this. This one is better, this one is better. That one is from this country. Kindly just give a highlight on these various probably where they are from and why this is better, or is there anything that is better than, they said some of us who took AstraZeneca, we, so many, you've had most of some of these people, the public is coming out to say.
Yeah, and that is expected, and actually it's a genuine concern. But as I said, that all the vaccines that were deployed in the country passed the minimum mark for the 50% efficacy. That was the minimum for WHO, and all of them passed that minimum. And they work in different ways. Okay, we have the Pfizer vaccine and what they call the mRNA that is injected and makes your body produce similar proteins that mimic the COVID-19. Then most of the other vaccines, the AstraZeneca, the Sinovac, work in the usual technology where a killed vaccine is a killed virus is put into your body, and the body reacts thinking it's an actual infection and builds immunity against the disease. So by and large, the vaccines are comparable in terms of baseline. And what we are saying, the emergency use listing, we are not manufacturing vaccines in Africa, in Uganda, and we are relying on external technology and the existing World Health protocols and reviews to make the choice as a country. And what we are saying as a Ministry of Health is that the best vaccine is what is available to you in the shortest time available.
Okay. And you did talk about the people now that you're going out to people. We've seen a couple of drives, you've seen opening up of centers, you've seen in churches, parks, cities and what. What's been the response so far?
The response has been good. The city square and the old taxi park, and I think this was a clear demonstration that there is no hesitancy or there is no resistance for vaccination in Uganda. It is an issue of access and people knowing where to find this intervention. So bring the services closer to where the people are active. These are adults. You have to go where they're doing their business. You have to be on their routes. So you have to go the extra mile. Unlike other routine vaccinations where you sit at the facility or a predetermined routine station and wait for mothers to bring children, this time around for COVID, we have seen that you have to go out and reach the business where the adults are on their routes, transit routes as they go to work, and the center of the business hub in Kampala. So there is need for the health managers in all districts to ensure that they do open ground and visible stations, and also maybe for the elderly to do parish by parish mobile teams that can move and reach the populations, and of course with heightened community mobilization. I think that's what I've learned with the COVID-19 vaccination. We can't do business as usual and sit and wait for children to come for polio. Adults are on the rush. We've seen other countries run after people in the jam. So I think now we need also to find a way that it's close to that that can work within our setting, being innovative, asking the communities and ask also the communities, creating demand. If the people in the taxi can, we are saying for us borders, we are at this stage, can the city authority bring us a vaccination site here? So there is need for the public and the leaders for the association, business groups, markets, to demand through the local leaders who are actual mobilizers and ensure the services are brought to your people as your responsibility, because you're representing the people at your particular setting or locality within the cities and the districts, wherever you are.
There have been outcries by various people in terms of vaccination. Some people say when you go to this place, there are no vaccines today. Why I say this is just to also probably, I hope our viewers understand, how many vaccines do we have so far? At least, or do we have enough, if I may put it that way? Like how are we standing in terms of the vaccines that we have?
Yeah, so since we started, the challenge actually has not been demand, as I said. It has been logistical. There was limited supply and also the vaccine. So that's why we prioritized and said the high-risk groups first, as we bought time for the stock to stabilize. But where we see us going, it's no longer an issue of logistics. The supply is tending to increase. We've deployed over 4 million doses since the launch, and as I speak now, over 2 million doses are in the districts. And in the Teso and Lango regions, actually, we just kept vaccines just for that accelerated campaign. And I would say, to answer your question, the challenge is no longer logistical in terms of supply, but it was in the last 7 months.
And now that we have at least the vaccine, we have the vaccines, what are some of the challenges you're facing away from if vaccines are there, still have challenges of people not being very well immunized and what. What are some of the challenges that, in your opinion, as a ministry, that you've been able to find that relate to why we are having probably a slow pace of vaccinations in some areas? At some point, you even come out to tell us that some vaccinations are going to get expired and all this.
So Felix, as you know, all government business in Uganda is decentralized, and also health and service delivery as well as immunization in Uganda is provided in a decentralized way, and that is through the district local governments. So the challenge we have seen is the issue of how we coordinate with the local governments, how the local governments embrace with their leadership to really hold these short campaigns and consume the products within the shortest time, because we see most of the products we get have 30 days shelf life. So it is an issue of district governments being able to mobilize their technical staff, being able to be innovative and open these sites where the people can see them and not just sit and do routine clinical work and expect random entries for vaccination. So there has to be deliberate move to create access, provide information and mobilize communities and ensure that we really fulfill the President's pledge to ensure that we vaccinate as many people as possible before the opening up of the economy 2022. So it is up to us as Ugandans to create demand, us as local governments really embrace and monitor has vaccines arrived, how do we deploy in 1 week, so that we can also free time for the health workers to attend to their routine essential care services.
There are very many falsehoods that surround the COVID and majorly the vaccination. I'll tell you one, or two or three. We have had previously people who have been dying of clots. Some people say it has the devil's word. Other people say it is 5G what. All these, one would call them myths, one would say lies, someone would confidently say it's true. How are you dealing with such in terms of this particular drive?
Yes, so as we have been struggling with the COVID-19 pandemic, there's also been an infodemic. Information, and everyone these days is a scientist of sorts.
Yeah,
so, but what we have done is really to continue emphasizing the issue of the risk of the disease, the reality that COVID is in place, and they need to ensure that we are maintaining the standard operating procedures, masks, hand sanitizer and hand washing and social distancing and preventing, avoiding crowds where you can. So, and people have also seen people die in the second wave, you know. It has become, before people had not seen, you know, Africans want to see by, they want to...
touching.
Yeah. So when people lost people and really saw that, I think with time the infodemic began waning away. So some of them we handle in big picture by providing the right information through Q&As, using social media, coming to TV, and also talking to the media personnel who are out there to continuously help allay some of these, to relay some of the right information to the public. But also what is good to see is that parents and the community, immunization has not only come with COVID, it has a background. We have seen the vaccination as an intervention that eradicated smallpox. It is on the way to eradicate polio. So at times there are some things you handle case by case and not give it the response. Because at times social media, if you respond, at times you blow up and give significance to the negativity. So it's case by case and focusing on the right information. And we're telling the Ugandans that the system that provides other medicines, the Panadols, the Coartems, is the same system we are using to procure, to regulate and clear these products. So there's need to trust the government and decisions they are making for us and protecting the next generation.
Well, because of the pandemic, we have noticed that very much attention has been given now to the pandemic and the coronavirus, and in major hospitals, like a couple of months ago where we had challenges, oxygen, what. Also, the ministry has been on spotlight for having abandoned other sectors of the health sectors, like in terms of other illnesses, malaria, cancer, what. Isn't this a threat that we may cut the deaths in COVID-19, but rather have an increase in other causes?
Indeed, Felix, that is something to reckon. But by and large, it came around due to the lockdown, the restrictions that affected both the clients, the pregnant women, the mothers bring their children for immunization. So the lockdown, limiting the transport, and those restrictions also had the spillover in terms of seeking care, and also the health workers being able to reach their places of work. So also but what we are trying to allay with the vaccination is short vaccinations, open grounds, short visibility, and then you proceed with the routine immunization. Yeah, but there is need to pick our lives beyond COVID and think about the continuity of essential services, as you have said.
Yeah, surely. And also, maybe for our purposes of our viewers, we have heard about the two things, probably if you may break them down for us. One, the vaccination of infants. Is it infants or below probably the age of 18?
1 year.
Exactly, infants then. And also the boosters. We have heard somewhere that there may be a jab for boosting. Kindly give us comments on these two. Let's start with the one for infants.
Yeah, so routinely, government provides vaccination for children under 1, that's the infants, at birth, at 6 weeks, 10 weeks, 14 weeks, and 9 months. And of course, we also have the vaccine for girls, the ones against the cancer of the cervix for the 10-year-old girls, and the tetanus toxoid for the women of childbearing age. So these are routine vaccines that government has invested in over 3 decades. Okay. Yeah, so in addition, for immunization, when there is an outbreak in the neighboring countries, when there is potential risk for importing, and also through routine immunization, Felix, we've noted that almost every year, 100,000 children are not reached with vaccination. Yeah. So if we keep accumulating these children, we build a mass of unimmunized population. So there is need once in a while to come in and boost and give a second opportunity to address that immunity gap through booster doses. But what is planned for the polio campaign that you're talking about, that is following detection of a polio virus in sewage in Lubigi. So the polio vaccination that is planned is responsive. Detection of a polio virus in human samples or in sewage is a polio outbreak. So there's need for a reactive or a response campaign, Felix, and that is what is planned to be conducted in all districts in the country for children under 5 years. They will be getting the oral polio vaccine as a booster and also as an opportunity to also respond and ensure our children are protected against this circulating polio virus.
Wow. Actually, speaking about polio, now that you brought me on that side, I would want also to get a sneak peek into, we have been, with this whole polio thing, we thought we were on top of it. Not until a couple of months ago when we had scares and what and all this. Now we are talking about vaccination. We thought this was the order of the day. What did we miss? What did we miss for us to get back to this position?
Yeah, we did not miss anything, but diseases do not know boundaries. Well, we did our part and we have no polio. Our last case was in 2010. Other countries where there is insecurity, Afghanistan, Pakistan, that means children are not reached in routine.
Oh, yes.
And the population mass that's not immunized over time keeps growing. So there is still polio in those 2 countries, and also we have circulating viruses in South Sudan, in Kenya and Congo. These are our borders. Yeah. So, and we have porous borders. Kampala is a business hub. Buses are moving from West Nile every day to Kampala. And the virus that was detected in Lubigi was actually linked to a case in Sudan, Khartoum.
Wow, so it was supposedly to have come...
Yeah, from somewhere else.
Okay.
Yeah, and that is how diseases are, and that is where we are. But we are saying we are not going to rest. There is need to boost and provide an opportunity to protect the children of Uganda against these polio virus that are saturating around us and evidently have been detected in our environment. Meaning someone, a child or an adult or a visitor or a native could have shared the virus in there, in the sewage. That is why there is need for continuous surveillance through our sewage and also ensuring all children under 15 years with sudden onset of weakness, we investigate for possible polio. So we are not relaxing despite the gains. There's need to maintain vigilance and provide an opportunity to protect our children against these vaccine-preventable diseases.
We used to know, as a matter of fact, that polio is key for children being immunized at that level. Has anything changed yet, or it is still the same deal? Who passes to be vaccinated with this drug?
Yeah, for routine immunization, it is children under 1, the infants.
Yes. And
also booster doses for this campaign, we are saying it is for all 0 to 5 years. But because of the World Health Assembly declaration of polio as a public health emergency of international concern, these days when you're going to other serious countries, Felix, you either have to show your polio vaccination or you get the 2 drops as an adult.
Wow.
Yeah, that is it.
Clearly now we are also vaccinating adults for polio.
At entry, some countries that screen, those diseases of public health and of international concern, they do that, and it's not harmful. And we also have seen that polio also manifesting in adults, especially in the places where the routine immunization is suffering due to insecurity and due health system issues. Wow. We have seen polio cases in persons above 30 years.
That's very strange. Actually, growing up as kids, we used to think that it was only for at least people who are babies, for that matter. But again, about polio, we know that we purchased, I don't know how, but I think 10 million doses, or what? Kindly give us an update on that and how it has been disbursed. Where can people get these vaccinations? And how accessible are these polio vaccinations?
Yes, so once you detect a polio virus, it now becomes the Global Polio Eradication Initiative. And
when you talk about polio detection, kindly break that down for us.
So the polio can be detected in human beings through stool samples. Okay. It can also be detected in sewage, in the environment.
Oh, so it's a medical process?
Yeah.
Because just like when you talk about the corona, someone talk about the symptoms, you see this, you see someone, then you can. But for polio, someone has to go an extra mile to go for a checkup.
Yeah, okay. That's why we are saying children under 15 years presenting with weakness or paralysis in the legs, we take off stool and take it to the Uganda Research Virus Institute. That is why they confirm or rule out polio. Okay. We also remove periodically sewage samples from selected sewage sites and also check randomly for any shedding in the environment. So once you detect a polio virus through any of those means, it becomes a public health emergency of international concern, becomes a global issue. So following that, we were supported to conduct risk analysis, and Uganda was really advised to mount a response. So we got vaccines, over 10.9 million doses from the Global Polio Eradication Initiative, and this is meant to be given to children under 5 years. Vaccination is going to be conducted in all districts for all children under 5 years, and health workers will be coming house to house, door to door, to give all your children under 5 years the oral polio vaccine, 2 drops in the mouth. Our health workers are going to follow the COVID-19 SOPs. We've provided them with masks, sanitizers, and so we beg that you really provide us that last chance to ensure that you provide a booster dose to your children and protect them against the polio virus that is circulating in our environment and in the neighboring countries.
Okay, now just also to take you back into this whole COVID vaccination, having looked briefly, I will be getting back to the polio aspect, but there's something I want to interest you in. Earlier on, we did talk about the particular targeted groups, and these included a number of people. We looked at health workers, you talked about people in the education sector, of course the elderly, and of course people with comorbidities. In particular, for example, now that we are looking at opening up schools, if most of them are already open in terms of tertiary schools, like the higher institutions of learning, is there any plan to particularly focus on this group so we see how we can also exploit now that they are around the schools to be able to vaccinate more and more people?
Yes, thank you, Felix. So for the last 8 months, we've been targeting that high-risk groups, the teachers, health workers, persons with underlying medical conditions, to allow for the high-risk group to be protected as we buy more time for vaccines. But right now, as I speak, we've opened up vaccination for all persons above 18, irrespective of your occupation. Not as long as you're 18 years, you're a student, you're a peasant, you're all eligible for vaccination, and you should turn up to your nearest health facility and demand for this vaccination. So vaccination is for everyone above 18, Felix. Okay. It's no longer prioritizing the high-risk groups. Okay. We cannot wait for the high-risk groups for 2 years. Sure. So everyone now above 18, please go to the nearest health post and demand for your COVID-19 vaccination.
Well, of course, maybe now, Ms. Immaculate, I would want to just read a couple of, some of our viewers are bringing a couple of messages trying to get to know. And one comes out to say, good morning, doctor. May we please know where vaccination is taking place in Makindye, because people are eager to go for it. And even the point at Old Taxi Park, health workers left. We don't know if you closed off that point, but I don't know if you may be in the know of some of the places around Makindye where we have vaccination.
Thank you so much for that concern. Makindye, I'm very sure Tisugu is vaccinating, and maybe I can read the number of the person in charge of vaccines in Makindye, okay, so that he can give you more detail. It's unfortunate that these open grounds were closed.
They were closed?
Yeah, we could not sustain presence, so, and KCC has not yet taken over those sites, but I know with time they will be open. But what I need to say, that all the traditional health facilities, Chiswa, Chisenyi, City Hall, they are vaccinating. But you know, people want access. Yes. You know, they want what's quickly.
Yeah, as of course, as you said earlier, now we want to bring it closer to people so we can be able, like, in marketplaces.
So you'll tell them, go to Kawempe, go to Komamboga, and they will.
Convenience.
But people want access. Someone, So the person that is in charge of vaccines in Makindye is 0774 178 868. So feel free to go to your division offices and inquire. These people offices are here to serve you. Okay. Don't just sit in your house and wait, always vaccination. Go to Rubaga division and make an inquiry at the health office. Where are the sites? But you know Rubaga will be vaccinating, I'm very sure. And Kawala. Okay. But people want quick, accessible places. Now, another question coming in also, one is asking that in case I have a site and I want to offer, I have a crowd of people, let's say like a school or university, to partner with you, what is the procedure? Wow, that is really a very good initiative. And that's the kind of thing that we need. Organized groups make it easy to mobilize people and also reach people in the shortest time possible and minimize wastage of the vaccine as well if you have. So when you have this, you just go to your district health office, the division medical office, and just notify them. That is all you need to do. Okay. Yeah. So, and you can also call the Ministry of Health toll-free line. All right. And they can maybe forward, but the district health, these offices are not planets. They're your offices. They're there to serve you and provide clarity and link you to the essential care and services that you need. So please feel free to reach your district health offices, your division or city health officials and demand for vaccination. I know your leaders, if it's a border stage, if it's a taxi stage, if it's a market, those people know who to reach. Okay. Yeah, your LC3 know who to reach by sub-county. Yeah. Up till today, do we still have high point areas like you did mention, like initially it was Wachiso and Kampala where we had the prevalence was so high in terms of COVID-19. Has it changed or is it still the same that we are having many cases, or the most threatening areas being these particular points? Yeah, it has been Lango region. For now, that Gulu stretch, the highway from Kampala to Gulu Lango. But you cannot rule out Kampala, so those are constant hotspots and places where you have to be really on guard all the time, being the business hub and transit route. So it is still kind of the Kampala are still hotspots for transmission, and recently also the Lango region, Teso region, and that is why the accelerated response is being conducted there this week. Okay, and just also to ask still about these vaccinations, you talked about the issue of having information out there. I have seen you partnering with a couple of people, industries, corporate world and what,
Probably you could just also touch, throw some light about what kind of partnerships you're having lately, and is there anything we should expect? You have seen some with, is it Beolaga, or any partnerships we are looking up to?
Yeah, it is really anyone out there that can mobilize people in the shortest time possible. That is all you need. And tell us we are here and demand for a team to come and provide the services. Okay. It could be parish priest, it could be LC1. So it has no category. You know, we've been dealing at the high level with partners in terms of planning, implementation. But when it comes to reach, you need someone closer to the people. Okay. And we have dealt with corporate companies, including the breweries.
So even the Uganda.
The breweries, Uganda, the cultural leaders. So it is really, we are open. Okay. As long as you can put people out there and inform us, and we come and provide the vaccine and protect your followers and fans. That is all that matters. Because at the end of the day, life is all that matters. Okay.
There's also another question that came in from one of our viewers, and they're asking that upon being vaccinated, what should be expected in terms of documentation? Okay. Do we just take the vaccination card? People are talking about certificates. People are talking about what happens? Do you get vaccinated and go home? Is that good enough?
At the vaccination, what you get your consent, but now it's no longer even a requirement because it's causing a lot of delays at vaccination sites. So what you really get is a vaccination card for starters, the hard copy. And when your data is entered in the system, that is when you can be issued or get a soft-generated certificate. But really, the assurance is a vaccination card.
Okay, where can we get these certificates from? Because I have had, again, viewers asking about who gives the certificates, where can they be gotten?
The certificates are automatic. You just enter your details and it comes online. Maybe later I can leave you with a link and you can show it on the screen.
Okay. Yeah. Okay, because now that's been the biggest issue. So when you go for the vaccination, make sure you're registered, and at that point you're given a vaccination card that shows the date of vaccination for those who will have 2 doses, when your next vaccination is. And then that's what you take physically. But your data, once entered, you'll be able to retrieve, say, the certificate when you go through that online process. Second question, again, from one of our viewers is asking, these various 2 jabs, in case one missed, for example, some people took their first jab and then they passed like a month or 2 or 3. Earlier on, we used to have challenges of second doses. Some of us who did the first jab of AstraZeneca, we had challenges. Does this have an effect on how the vaccine is used, or it's productive in the body?
So what is confirmed is what is prescribed by the health worker as per the manufacturer's guidance. For Pfizer, 4 weeks, Moderna 4 weeks, Sinovac 4 weeks, and the AstraZeneca 8 to 12 weeks. And of course, Johnson & Johnson is a single shot. But we are saying at whatever time you come beyond that prescribed period, it is still okay. And all these vaccines, Felix, are still under study, clinical trials. That's why we are saying they are being used under the emergency. They were brought out under the emergency use, considering the pandemic. So it is not too late. At whatever time you come, you can still get your second dose. Okay. You never know, even later we might need boosters. All of us that have already received our doses.
There's also been another question, Madam, about the cross of these vaccines. Some people say, I first got AstraZeneca, now I want to go and get COVAX. Now, then when they hear Johnson & Johnson has come, they will say, I think this one. What is the right way to do this? If you take an AstraZeneca or Pfizer or what, can you mix some of these, or it has to be one? Kindly highlight this, because also that's a question that came in from one of our viewers.
Experience from other countries has shown they're already doing that mix matching stuff. But looking at our capacity here, we are still not recommending the mix and match.
I beg your pardon, you said recommendation from other countries?
Yeah, they've done small studies showing the mix and match, but with limited evidence. everything is still under study. And when you do that for now, and considering this capacity we have to monitor and how the follow-up things we are doing on our clients, you do that at your own risk in terms of safety, because we don't know. All we know is Sinovac, if you get it, you get this, your second dose. We don't have enough information on the safety and implications of the mixed matching of vaccines at this stage. As we are waiting for more studies and evidence from the WHO and other experience from other countries, and maybe with time, all of us may get booster doses of something else. But for now, you mix and match, you get Sinovac, AZ, mix at your own risk.
Wow.
We cannot really help and bear that risk that comes with that.
It's not yet well studied for our case as Uganda.
Yeah.
Maybe one of the last questions that also came in is, our viewers also want to know what, like, is the doses we are taking, are they lifetime doses? Someone was asking, are they lifetime, or after 5 years we will have to go back? Now that even you mentioned the fact of still studies, do we expect at some point that we will have to go back for some other doses?
Okay.
Or, you know?
So the technology that was used to develop COVID-19 vaccine was built on the influenza, the flu vaccines.
Oh, yes.
And we think and anticipate that there will be requirement for booster doses based on a period that will be studied and how the pandemic evolves.
Oh, yes.
So for now, it is what we is to get as many as possible with the initial first two or first, and then wait. Because it's unfair in Uganda to get a booster when someone else has not gotten a single shot. So that's why we are saying, let's first ensure everyone gets the baseline, and then we wait for the emerging evidence. But most likely, like other flu pandemics, there is going to be a requirement for booster doses on a prescribed period. Yeah.
Okay. Probably also your comment, again, from our viewers, your comment about the local innovations. At least up till today, we have some people who have come out of the market to say we have this, we have this, we have this. Some of us who are traditional, we have also noticed that some things are working from home. What is your general comment about these other forms of aids towards the resistance we are putting up against COVID-19?
So most of those things work when you're healthy.
Oh.
They do like a maintenance, like supplements, herbal things, good nutrition.
Oh, yes.
It works now to prevent. But once you're in it, and you're in the high risk groups and you're on oxygen and you're still manipulating yourself with those things, it's really a waste of time. So those concoctions, herbal things, most of them relieve, like the cough mixtures. They relieve the symptoms, sore throat and what. And also some of them have vitamins for well-being. So most of those products are best taken earlier, not treatment. Yeah. Like food. Food is medicine. Once it is taken in the right way and prepared in the right way, you remain healthy, and also in hand with your mask, social distance, and avoiding crowded places if you can. So most of those herbal things and innovations that are non-pharmaceutical, they best work in your healthy well-being, preventive, and but not when you're already in crisis. Yeah, so you can take it now
when
and feel good and feel and give yourself vitamins. This is a time now to keep healthy. But once disaster strikes, you have to visit the health facility for appropriate care.
Okay.
Yeah.
Have we been able to increase our capacity to deal with COVID patients, at least since the last challenge we had?
We have, to some extent.
We used to have discussions of beds had become beds.
But how many beds are you going to buy? That's why we are saying immunization is the most cost-effective public health intervention. It is costly, but when you coin it up and look at the impact in deaths prevented and the beds you would have procured and the time spent in hospital, it is still the most cost-effective public health intervention. And that is why the government chose to invest more in the vaccination, and also minimal capacity in terms of oxygen installments and the bed capacity in the treatment centers.
Okay.
But people are not, so embrace it. So that's because after the high risk groups, it will now be herd immunity. The more you have vaccinated, the more you're protected.
Yes.
Yeah.
Maybe lastly, let me just also ask this question, that now that we are all struggling to make sure everyone gets vaccinated, what are we missing in terms of having the right numbers? Because there's a point, like at some point when you go, like some places, when you first put a spot at City Square, people were so many one day, then tomorrow. You go to the old taxi park, so many, then tomorrow. Have you made any study into what informs, and you did mention one of the things is accessibility. What can we do better? Like now we're talking to the public, what would we tell them? What advice, what recommendations do we give to our viewers out there for this ongoing vaccination campaign? What
we can really say is that we have structures in Uganda to support the public to receive the service. If you can organize yourself in groups through your leaders and connect the service providers, they can come to you. And also the health workers and the health system, there is need to go the extra mile.
That means
if we are just going to wait in Tisenyi for everyone to in the Rubaga or Central Division to come, people they have to open the malls.
Yes,
people are in the markets. Yeah. People are looking for mere.
That's very true.
So you have to move and go to the market. We have the contacts with the market authorities, the city council, to organize and step by step, maybe parish by parish, and cover each market or business hub. So there is need for innovation. The public health is your personal responsibility. It can only be repaired in the health facility, but while your health, it can be made at home. The decision, make it. Those in the malls, you can say for us in Mabilis Plaza, we are here on Wednesday.
Yeah, please.
Can we get a site? You know, we are going to buy the health worker, shall provide tables and chairs. To contribute, even if it is not money, in kind. That hand washing facility on the vaccination. That table.
So that's possible, because
it is possible.
That's what we want our viewers to know out there, that you can put yourselves into reasonable teams to support the drive, the vaccination.
Yeah, like the Nkoba Zambogo. I know in Uganda they are there everywhere. How have they mobilized to ensure that they
to use that as a channel?
They support and just demand the health worker to come with the vaccine carrier. So all of us, there is something we can contribute.
So all we need to do on our side as the population is to organize the space and give, like as you said, maybe a sport, tables, chairs, and be able to help with the organization, the queues and all that.
And that is and demand. And
once we are able to do that, who do we contact? Do we call
like in Kampala, the DMO, the Division Medical Officer,
where does that person sit? You see our people here need contact. If you can share a phone number or something.
I have realized Ugandans, the only place they know is the parliament.
But
the parliament is for lawmakers, but for service provision, it is the district.
But you don't blame them.
No, we need to really wake up. If we are going to consume the services government and our taxes are investing in, we had better wake up. The local council one is the first layer of government.
Surely.
Ask the local council to bring the Musao to your parish. He knows where to get it. Because I cannot read all the contacts of the district health officers here and the cows. I can't. But I know someone there in Butaleja knows where his LC1 is, his LC3 to mobilize, and also the nearest health facility. Actually, we have each health facility has a management committee with community members.
Wow.
So you can organize through all that, but the nearest it is possible. I cannot read all the district health officers' contacts now.
All right. Clearly...
but the vaccines are there, they are free, and they're effective, and they're for you, everyone above 18. We're no longer looking for health workers, it's for everyone, so that we can be able to support the president to open up the economy.
Okay, I would want to have your last comments, Madam, on this, but also polio, the vaccination for polio. We did mention earlier, just your last comments to our viewers before we hand over to the sports.
Thank you, Felix, for hosting me. My last call for polio is really, we are coming house to house to vaccinate all children under 5 years, starting from 3rd to 5th of December. It will be Friday to Sunday. Please allow
the whole country.
Yes, okay. All the country, the entire country, all the districts, all the villages.
That's good.
I will have a vaccination team. Please allow us to come. They will mark the little finger of your baby under 5, and also leave a mark at your door. So support us so that we can kick polio out of Africa.
Wow, I remember that saying when we were growing up.
Because Uganda kicked out, but we are surrounded by the threat. So we need to really contribute to the health of our continent and protect the next generation.
Wow, thank you so much, Ms. Immaculate, and also the people at the ministry, and in particular those under the vaccination and immunization department. Now, also our viewers, thank you so much for being with us, and of course for those who have been sending messages and following, and of course who have been with us since morning, for waking up and taking this seriously. But also we have much still coming. Ruben is out there trying to cook for you a bit of sports. I bet he will make a comment on the performance, maybe of Vida. Do we have Vida as a threat again with the coming of the tyrants, the likes of Mandela? I had my very good friend Bedad Segona also wanted at some point. What's the fate of Vida? Do we see Vida coming back to the table of men? I wait to hear that comment from my brother Ruben Kaseda Mpima. But for now, let's take a break. I will be back with sports updates.
Kaganyo twalekedde ekyatulese tuzze tukalanga enfunda eziwerako ddala. Eno ye GoTV Super ey'abakaguje njagala weekaanyi. Ewatali kwemamaaza olwo tuba tusimbudde ne GoTV Super dupa. Waawawa era nga bakutuusaako ekigo ekyaba